welcome to Military Neighbors, the Fleet and Family Support Center program on Skills for Living. My name is April Holtmeyer and I'm your host today. Special treat today from the Ledge-Lite Health District. Actually, we have with us Cindy Berry, and she's the Senior Program Coordinator. And first of all, I'd like to start out with because you're a familiar face around here, tell us a little bit more about yourself.
A little bit. I'd like to consider myself part of the Groton Municipal television family. We do a program once a month called Health Watch, and I've been hosting that for the last 16 years.
Very exciting. So the tagline for the Ledge-Lite Health District is promoting healthy communities. When I first moved here, I actually dealt with a tick bite, and the first time I ever heard of Ledge-Lite Health District was, oh, we need to take the bag tick to the health district. So that's how I came to know about that you guys existed. So can you tell us more about the mission of Ledge-Lite Health District?
Sure. And that's usually, April, the way that people come to public health is through a personal issue or a professional issue around one segment of public health, and then they learn that we're so much more. Public health, the public health system was really devised to promote and protect the public health, but also to prevent diseases, illnesses, and injury in a community. And we work very closely with our municipal partners. Every municipality in the state of Connecticut, by state statute, must have a health department, and when one health department joins with another health department, they can form a district. So that's why we're called Ledge-Lite Health District, and we serve the towns of East Lyme, Waterford, New London, Ledyard, and Groton.
Okay, so can you share with us the definition of public health?
I think I just did, and that's kind of it in a nutshell. Every public health department is a little bit different. We all are a little bit data and community driven, so the issues in one community might be different than issues in another community. And public health is, while we have kind of our basic core mission, we also work in the community to understand what the public health needs are of that community, and then work with partners to address those needs.
So you mentioned partners. Can you provide with us examples as to how you collaborate with community or establish community partnerships? Sure.
So we do a needs assessment in the community, which gives us an idea of what the particular public health interests and needs are. We then look to our public health partners, both traditional partners like healthcare providers, schools, businesses, but also some non-traditional healthcare partners and residents to come together to really form some strategies around how do we solve that problem. So most of the programs that we have and the services that we provide really are centered at its core with a coalition of sorts. And this is a coalition of people who are both interested in the topic, maybe they've been affected by the public health issue, or maybe they have a particular expertise and reach into a segment of the population that we really want to affect. So some of our coalitions do have healthcare providers, but they might have farmers, they might have small businesses, they may have some holistic health kinds of partners. They might have chemists or various segments of the population. So we're really proud of the fact that most everything we do is in partnership with our larger community.
So with the Healthy Communities initiatives, one of the things I know in recent hot topics would be mosquitoes and ticks. Could you tell us a little bit more about some of the things that you guys are doing to help with education for that? Sure.
So this time of year, we're very aware of the fact that mosquito-borne and tick-borne illnesses are very prevalent in our area. We work very closely in the community, and we have one kind of the arm of public health is our environmental or our sanitarians, and they're very active in the community working to identify risks for both for tick-borne illnesses like Lyme disease or babesiosis, and also mosquito-borne illness. They go out into the community. They may be looking for standing water, for example, which is a breeding ground for mosquitoes. They may be working around landscape modifications or giving information to groups that serve children, for example, a high-risk category for Lyme disease, just on how to protect children from Lyme disease, maybe how to educate kids on what does a tick bite look like, what do ticks look like, how to remove ticks, that kind of thing. But then also with working with landscapers on how do you maybe make modifications to reduce the deer population in a person's yard, because we know that deers can often carry the ticks that also carry Lyme disease bacteria.
Oh, good to know. So in what ways can Ledgelight Health District help with public health preparedness?
Okay, so we have a public health preparedness program. Chris Magnuson works in that area. She's also our community health nurse. She works also with emergency planners and tribal nations and community organizations to look at protecting the public health in case of an emergency. And so that could be a natural disaster, it could be bioterrorism, it could be some kind of a infectious outbreak. And they work very closely with partners all across the state to devise a plan, to make sure that the plan has been approved, to make sure that everybody knows what their roles and responsibilities are in case of an emergency, and then to be able to activate that. So you may have heard that we do a number of drills throughout the year to make sure that we can activate our public health community in case of an emergency.
Plan for everything. So one of the things I know that seems to be prevalent are power outages in our area, thanks to the gorgeous trees that we have and wind. Mm-hmm. So with that, do you have, or could you offer us your top 3 tips for how to go about with food safety in the event that we have like a power outage?
So food safety is a really important part of public health, and you may know that we inspect restaurants across our jurisdiction, and we want to make sure that those restaurants are employing public health practices and making sure that the community doesn't get sick from the food that they're serving. In case of a power outage, it can be very serious. If the power outage lasts for days, then food may spoil, and if it's not come to particular temperature, then it can pose a threat to the community. In terms of people, individuals, we work very hard to work on helping individuals to develop a personal plan, and keeping their freezer closed and their refrigerator closed as much as possible during a power outage really can help maintain the proper temperature. If the temperature drops below 42 degrees, then they really have to think about food safety. One of the things that I saw in a hurricane that we had a few years ago is a lot of people just having these huge barbecues, these huge neighborhood barbecues where they just took everything out of their freezer and barbecued it and cooked it up, and that way they were able to at least enjoy the food that they had and not worry about it spoiling. But that is a really important issue, and especially for our elderly, people that are shut in, that might not have the community support or the resources that a lot of other people have.
Okay, thank you. How can someone reach out to report a public health concern?
So we have a website, it's www.llhd.org, and somebody can write at our website, can make a complaint. But the best way is really to give us a call at the office. We take complaints from the community very seriously. We follow up on them rather quickly, and we work to resolve those public health issues. It could be that somebody ate at a restaurant that they didn't feel was practicing safe food handling, or it could be something out in the community that they see, a nuisance or something that they see, and we really want to hear from people in the community, because that's how things are going to get taken care of.
All right. And then in terms of your services, because you guys offer classes and other educational platforms to plug into, who's eligible to take those?
So anybody is eligible in our community, and that's one of the things that I feel most proud of in terms of public health. We really are there to serve the entire community. If somebody can't afford their flu vaccine, for example, we want to make sure that everybody is vaccinated that needs to be. We provide a lot of programs. Most of our programs are free. We only charge fees for certain licensing kinds of things, but all of our programs, our public health programs, are free to the public. In the past, we've done everything from education around Lyme disease, smoking cessation, asthma. We have a wonderful falls prevention program where we go into a person's home and we can do an assessment or an audit with the person and really determine what the risks are. That's completely free. We have a similar program for asthma. People who are suffering with asthma, maybe there's some very simple fixes that they can make in their indoor environment at their home, and we can go right into the home and work with them around their medications and their risks for asthma. So I'm very proud of the fact that our services are free.
That is wonderful. So we are actually going to take a break. So when we come back, we're going to hear more from Cindy about another initiative through the Ledgelight Health District and community partnerships when we come back. Thanks.
Chris Domine is a husband and a father. Chris is an athlete. Chris is even an Ironman. But 10 years ago, Chris was facing a very different story because his kidneys were failing.
Basically, the doctor said, if you don't get a kidney transplant and if you don't do dialysis, you are going to die.
Fortunately, Chris received a second chance at life, made possible by an organ donor.
You know, your well-being changes, you know, from loss of hope to better times ahead.
More than 100 million people in America are registered organ, eye, and tissue donors. People of every age and ethnicity, because they believe it's the right thing to do. Imagine what you can make possible by leaving behind the gift of life. Learn more and sign up as an organ, eye, and tissue donor. Go to organdonor.gov.
Join all the fun at Groton's 11th Annual Fall Festival on Saturday, October 8th from 11 a.m. to 5 p.m. at Pequannock Plains Park. The Groton Fall Festival is one of the largest community celebrations in Southeastern Connecticut. This year's Fall Festival features artists, crafters, exhibits from local businesses and organizations, a farmer's market, as well as food and entertainment for the whole family. Admission is free. For more information about the Groton Fall Festival, visit grotonbiz.com.
You're going to need me. You're going to need us. All of us. You're going to need our technical skills, our math, our engineering skills. You're going to need our help with your water, your air, your food. You're going to need our organizational skills, our problem-solving skills. You're going to need our determination, our honesty, our compassion. You're going to need the next generation of leaders to face the challenges the future will bring. And we promise we'll be there when you need us.
Welcome back to Military Neighbors. Today my guest is Cindy Berry with the Ledgelight Health District. For the second segment of our show, we're going to be talking about farmers markets in our area. So thank you again for being here. So with the Ledgelight Health District, there was a USDA grant or funding that was received for farmers market to be established in the new London County area. So can you explain to us more about this project?
Sure. So farmers markets are widely popular. Everybody goes to farmers markets, it seems, these days, and popularity has really increased. We noticed through managing some of the markets in New London that the markets in New London County were kind of largely disjointed. And so we found that there was an opportunity to bring market managers together, really to learn how to be a market manager, share techniques and ideas for advertising, and how do you get farm vendors and work with local farmers, but then also how do you promote the market in the community. So through this grant we're able to really look at markets in New London County and to make sure that they're all prospering, to make sure that farmers who want opportunities to sell their farm goods take advantage of farmers markets, and generally promote farmers markets to all community members, but especially people who have lower access to healthy fruits and vegetables.
So can you provide pertinent highlights from, because there was a needs assessment done, as you had mentioned in the first segment. Can you provide the pertinent highlights from that?
Yeah, in 2013, the New London County Health Needs Assessment identified heart disease as the #1 cause of death for people living in New London County. No surprise.
Right.
One of the things that we really need to focus on is improving nutrition as a preventative measure. And farmers markets really do help in that regard. They're listed as one of the strategies that is promoted by the CDC for healthy communities. And so we really felt that there was an opportunity to look at farmers markets in New London County and especially make them more accessible for people of low income.
During my research for this segment, I came across the word food desert. Can you explain more about that? Because that was in the needs assessment.
Yeah, one of the things that we wanted to address was the fact that the city of Groton is located in one of the last food deserts in New London County. And the way that the USDA calculates a food desert is really through a whole matrix of different things. One of them being lack of transportation, lack of access to a grocery store, proximity to a grocery store, the income of the population. So a whole bunch of things go into the matrix of what a food desert is. And we're really proud that through this grant we're addressing that in the city of Groton.
So what would be the overall goal for this project?
Really the overall goal, there's two goals. The overall goals, one is to improve nutrition among residents in the city of Groton and also the city of New London. And then the other is really to promote and increase farm viability and support local agriculture.
And can you share some of the objectives with us?
Sure. So some of the things that we found through our various needs assessments in the community, one was that we needed a market manager association. So a place where market managers of the 19 markets that are now established in New London County can come together, can pool resources, can leverage the resources that they have, can really work on how do you make sustainable change in a community through farmers markets. We also want to increase the participation of farmers in farmers markets. There are so many new farmers now. The average age of farmers is around 60 in the state of Connecticut, and so farmers are getting older, and now we're seeing this really new interest in agriculture, in not only in academics around UConn and their School of Agriculture, but also in people wanting to take up farming. So we wanted to make sure that we increase the number of farmers that were participating in farmers markets. And then lastly, we wanted to increase market purchases by people of limited means, and that goes back to working with people of low income around their access to locally grown fresh fruits and vegetables.
And then okay, so does that mean that they take the Supplemental Nutrition Assistance Program, the Senior Nutrition Program, and Women, Infant, and Children vouchers?
Yes.
Okay.
So we wanted to, in New London, there are 2 markets in New London. One is located at Williams Park, and it's a Friday market from 3 to 6, and all of our markets run from the beginning of July through the very end of October. The second market is at L&M Hospital on Wednesdays from 3 to 6, and then our final market, our brand new market, which was one of our activities, is our Groton City Market, which is on Tuesdays from 3 to 6.
And can you tell us more about the Farmers Market Internship Program?
Yes, the internship program, so one of the other things that we found was that with farmers getting older, their capacity for bringing their farm goods to the market was diminishing. And we also heard from farmers, one of the barriers to attending farmers markets was being able to take time off the farm. Also, we wanted to increase interest in careers in agriculture. So we came up with the idea of starting a farmers market intern. This past summer, we had 3 interns from different high schools, and these were all juniors and seniors who gave half of their time on the farm and half of their time at the market. So on the farm, they learned everything from planting, weeding, harvesting, how to package things up to take to the market, a lot of farm practices, and then bringing things to the market, they learned how to make change, how to do mental math, how to greet customers, how to display their farm goods at the market. So it was really a great program for this year.
Wow. My next question is, because you mentioned the location, so can you share with us the major activities planned for the Field of Greens Farmers Markets?
Sure. So this year, one of the activities was to become more culturally relevant, especially in the city of New London, where the population of Latinos is growing. We want to make sure that people who are non-English speaking feel welcome at the market. So we've been doing some work to collect some data from Latinos, but also to welcome them to the market, translate our information into Spanish, make sure that we have somebody that speaks Spanish, because a lot of our vendors do not, and generally make people feel more welcome at the market. We also, like you said, EBT and WIC and senior vouchers, we also want to make sure that at all of our markets that we accept a supplemental nutrition program, coupons and EBT. People who have SNAP, which is the Supplemental Nutrition Assistance Program, they are given an EBT card, which stands for Electronic Benefits Transfer. It's kind of the old food stamps, what we used to think of as food stamps. They can bring that card and they can swipe it at the market, and then they can get tokens. And those tokens can be used throughout the market to purchase food for their family. Similarly, people who have WIC coupons or senior vouchers, which they get at the senior center, can also use those to purchase fruits and vegetables and sometimes honey. So we want to make sure that we let the community know that we accept all forms. We also have worked very hard not to stigmatize people of low income. So if you were to come to the market and you want to use your credit card, we do the same system. We swipe a person's credit or their debit card. We also give them tokens. So nobody in the market knows which tokens they are, or they came from EBT or they came from credit card. It's all the same.
Oh, that's good to know. Yeah. What are cooking demonstrations? Because there are vegetables that I don't yet know what to do with them when I get them home.
I'm very glad you mentioned that. We worked very closely this summer with UConn School of Nutrition, and they provided us with 2 things. One was kind of a comprehensive nutrition education tent at the market, and this was to give out information, and they came up with a fruit of the week. So like this week it's melon week, and we gave out samples of melon right from the farmers, and so we washed them at the farmers market, and we gave out samples. We've also been doing cooking demonstrations just to show some very basic recipes that include healthy foods, and then we also again purchase those foods right from the market on market day, and we let people know where they can purchase them at the market.
Oh, that's exciting.
It's really been fun.
Wow. So the last thing I have for you, or 2 questions left for you. One is, how can we reach out to you? How can we get in touch with the Ledge Light Health District?
Okay, well, people can certainly give us a call anytime. There's always somebody there. We are in the office, which is located at 216 Broad Street in New London from 8 until 4:30, Monday through Friday. People can also find us on Facebook. We're trying to get a little bit more savvy when it comes to social media, so we have an Instagram account, and we also have Facebook, so people can find us there and they can leave a comment or they can communicate through that way. But we also have a general mailbox. People can leave a message at any time via phone, and then they can email any number of us.
So lots of ways to get in touch with you.
Lots of ways, and we're out in the community. If you see one of our trucks or one of our vehicles, flag us down, say hi, let us know what your interest is.
Okay, so my very last question is, how can members of our community get involved?
There's a lot of ways to get involved. We have a lot of volunteer coalitions and activities. We even have a volunteer at the farmers market, people that are doing cooking demonstrations and taking information, and so we have volunteers in a number of areas. We also have student interns and college internship programs. We have a number of coalitions. You can find all those out on our website. We have a medical reserve corps, people who are interested in helping with emergency planning. We have a number of ways that people can involve, and there are a lot of trainings that are available through the State Department of Public Health. People that want to become lay educators or work in the community around public health awareness.
Okay, great. We are out of time.
Yeah, thank you so much.
Thank you. We are out of time, and thank you, Cindy, so much for coming and talking with us today. Lots of good information, and really liked the information about the farmers market. If you'd like more information about the topics that were mentioned today, you're welcome to give Fleet and Family Support Center a call. Our phone number is 860-694-3383. Weekdays, Monday through Friday, 7 to 4. And my name is April Holtmeyer, and thank you for joining us on today's episode of Military Neighbors.